both at Gunasheela Hospital in Baswangudi, and we deal with the male infertility problems. This is our fourth series in the patient education series from Gunasheela Hospital to explain to people the treatments and the problems that infertile couples face. In this series, we are going to talk about male infertility, and we talk about medical management, which is usage of medicines or injections to treat low sperm counts, and the various problems faced by male infertile patients. Now, there is a surgical treatment which we will come to in our next episode. Good afternoon. We will start with a few slides to explain to you the various treatments options available for male patients, and then at the end we will answer some questions which are very commonly asked by patients that come to our clinic. You can also ask us questions during this talk or later on at askgunasheela.com. We will be quite happy to answer those questions. Dr. Vasant, now can you just give us an idea about the patients that come to us with problems of male infertility? How common is it? And then how do we go about evaluating these patients?
Yes, good afternoon. Approximately 15% of the couples they experience infertility, and out of which 50% cases are involved, like male factors are involved in 50%, and in 50% female factors. So it's ideal to evaluate both husband and wife simultaneously to get a better result.
Yeah, we have stressed this point before.
Yes,
is that it is important for both the couples to be evaluated, not just the wife or the husband only. So, yes, and both the couples to be evaluated preferably in the same center, so that there is a coordination of both the wife and husband's problem, because we know that about 40% of the time both have a problem. It's not just the husband or the wife.
Yes.
So both have a problem. So we insist on evaluating both the husband and wife simultaneously.
Yeah. Now, what are the goals of evaluation? First, by evaluation, at the end of evaluation, we'll be able to find some correctable conditions. So if these correctable conditions are corrected, they can achieve pregnancy naturally. At the end of evaluation, if the conditions are irreversible, then we can refer them for higher level of treatment, like assisted reproduction.
Yeah.
And sometimes we should evaluate them by genetic tests, so that the offspring might be affected. So in these type of cases, we do some genetic testing, and we counsel the couple regarding the predictability about the transfer of those genes.
Yeah. So it is important now to evaluate the husband, and then also find if there are any. We categorize the patients into different categories. One where we attempt for a spontaneous natural pregnancy, or at the basic evaluation itself, we know whether the patient needs an escalated treatment or an assisted reproduction technology. So this is why we evaluate the patients, with history, physical examination, and investigations.
Yes.
Vasant, what are the causes of poor sperm quality? This is a very common question that patients ask. That why is my count less? Why is my I have a normal relationship with my wife, but why is my count less? This is a very common question, that one of the commonest questions, in fact, asked by patients. Now, why do you think? What are the causes of a low sperm count?
If a husband has a varicocele, then that can cause poor sperm quality. A varicocele is dilatation of veins in the testes, where there will be defect in the walls. So the return of impure blood will be a problem, and the impure blood stays in the testes for more time. So that could be one of the cause for poor sperm quality, and this can be detected by examination. And sometimes infection of the testes and epidermis can cause poor sperm quality. Sometimes antibodies can be present in the semen, that will affect the sperm. In few cases, there might be undescended testes. So by birth, the testes are in the scrotum, but during development, the testes are developed in the lower abdomen, and then it descends further to the scrotum by birth. If by any chance, if the testis is inside the abdomen, then that could be one of the cause for poor sperm quality, or sometimes zero sperms. And hormonal imbalances. So that could be the cause for poor sperm quality.
Now, these are the common causes that we evaluate for patients, and then we broadly kind of get an idea as to what could be the problem. And this can be done with history and physical examination, which is very basic without doing too many investigations. So once we categorize the patients, and then we start doing investigations to see what could be the cause and potential treatment options.
Yes. So sometimes other causes of male infertility is some husband will be having erectile dysfunction, retrograde ejaculation, or sometimes they might have undergone a vasectomy because they would have completed a family. For unfortunate reasons, sometimes the successor might have succumbed. They might have to they will be planning for pregnancy. In those type of patients, they have to consult us.
What are the other causes? People are worried about using laptops, or people are worried about sitting in for long periods of time, and then using mobile phones, and a lot of things are there. Can you just tell us something about these causes also?
Yes, sir. There are environmental causes that causes poor sperm quality. Overexposure to certain toxins or environmental elements like heat, toxins, and chemicals, and industrial chemicals like toluene, xylene, pesticides, herbicides, organic solvents, heavy metal, and sometimes radiation exposure, and overeating the testicles. So these can impact on the sperm quality.
Now, most of these conditions which have been mentioned, there are some of them are hypotheses, some of them are proven. Now, because there are so many factors that affect the semen quality, it is very difficult to pinpoint and say this could be the cause or that could be the cause. So how we look at a situation is we definitely take a detailed history to see if there is any exposure to any of these toxic elements. And if there is, we try to eliminate that one by one. So that is how we work on it. But if you ask us whether this using laptop for long hours can cause a problem, or using mobile phones, specifically if you ask us, we don't have any great evidence at this point in time. But when there is an infertility, when a patient comes to us with infertility, we try and eliminate one by one of these factors, so that we try to get the patient to a situation where he can give us the best quality sperms. Now, there are other issues I want to ask you, Dr. Vasant, about people are worried about lifestyle and use of certain medications, supplements, etc. Can you just tell us a little bit about what are the lifestyle issues that can affect sperm quality?
Yes. Especially younger generation, sometimes drug abuse like anabolic steroids, especially the younger generation, people going to gym, those who want to have faster results in muscle growth. Few of them will be taking anabolic steroids, so that can definitely damage the testes. And drug abuse like cocaine and marijuana, and excessive alcohol intake can lower testosterone levels and cause erectile dysfunction and decrease sperm production. Tobacco smoking, it has been proved in causing poor sperm quality, as well as the tobacco damages the DNA in the sperm. That is being proven. And emotional stress also plays a role. Depression, obesity, this is quite rapidly increasing. Because of obesity, there will be hormonal changes, and so there will be a problem in sperm production. So these are the lifestyle issues which we commonly see in our patients.
So if we look at some of these issues, I think use of tobacco, either chewable tobacco or smoking, is beyond doubt known to affect the sperm quality. Now, excessive alcohol again reduces testosterone, which is a male hormone which is important in sperm production. Excessive use of alcohol is a double-edged. It can have multiple effects. It can also reduce the sexual drive, as well as affect the sexual performance, and also reduce the sperm count. But by and large, we have seen that if the tobacco is used, it's a very, very detrimental situation. So we strongly encourage patients not to smoke or use any forms of tobacco during the period when they want to try for fertility. Now, after that, after the evaluation, we come to and we make an analysis of the patient, and then we have to approach the patient and say what treatment would be suitable. Now, can you just tell us something about further evaluation of these patients, and then we'll come to the treatment.
And one more point I want to stress on lifestyle is These are the couples which are they are younger. As we are a clinician, we should advise them on a proper healthy lifestyle so that their future health will be a healthy life. Otherwise, if they continue on the bad lifestyle, they might end up in getting diabetes, hypertension, and obesity related problems, and it will impact on the quality of life in their 50s or 60s. So, as clinicians, we are seeing younger people. We should definitely stress on lifestyle changes on these younger people.
Yeah. Now, how do we come to a diagnosis? I mean, every illness or a problem has to have a diagnosis. And how do we evaluate the patient? And diagnosis is usually done by history, physical examination, and investigations. We come to a diagnosis, and then comes the treatment. Now, how do we go about evaluating a patient, and why is it important for the patient to come to the hospital and not depend on emails or WhatsApp or telephone calls when it comes to a certain situation like this? I want you to tell us what are the things that the patient will undergo when he comes to the hospital, so that these patients exactly know what is going to happen to them when they come here.
The first and foremost thing is the history taking, and why people like patients should come to us is because we need to examine them, especially in infertile male. We need to examine the testis size and look for any clinically whether there is any varicocele. So that is very important. That we can't do over phone or video thing. So better to come to us and we examine, and then we can make sure that they have varicocele or whether they don't have varicocele. Simply by sending email or sending an ultrasound report showing varicocele doesn't require treatment. It should be palpable on clinical examination, and then it should be confirmed, and then only
Yeah,
we should
the important thing is physical examination will also give us a lot of clues, visual clues as to many things, whether there is any hormonal issues or, uh, like Dr. Vasan said, the size of the testes, the development of the person, the secondary sexual characters, a whole lot of information that doctors get when they actually physically talk to a patient and do a physical examination. In these days of digital, many patients want treatment based on emails, and that's probably not a good idea. One visit to the hospital is definitely very useful to see your clinician, have a rapport with him, get a physical examination done, and then appropriate investigations can be ordered.
semen analysis is the most important thing. And sometimes if we suspect retrograde ejaculation, we do urine analysis, that is post ejaculation urine analysis. We might have to do a scan of the scrotum. We might do some hormonal testing like FSH, LH, and testosterone. And sometimes when the patient has zero sperms, we do genetic tests called karyotyping and Y chromosome microdeletion.
The importance of his history and physical examination is that it gives us an idea what investigations to order. Otherwise, there is unnecessary wastage of money and resources just to order all the investigations and waste so much of time and money of the patient. That is not fair. So, once we have a good history and physical examination, that will give us an exact idea which is a specific investigation that we need to order without wasting too much of money and time.
So these are the reference values which was discussed last week. Thing.
Now, once we make a diagnosis of the problem, and then we have various ways with which we approach the problem. Now, today we are going to talk only about the medical management. It means we are going to leave any surgical management of male infertility out of this today's topic. So today we are going to concentrate only on the medical management, which means could be medicines, hormones, injections, tablets, etc. So when we come to the medical management, Dr. Vasan, can you tell us how do we approach the treatment of these patients?
Yes. So, if on evaluation, we'll be able to find whether they have a reversible condition or an irreversible condition. If we know that there is a specific cause for infertility, and we treat that as a specific treatment. Most of our male infertile patients, we will be not able to find exact cause for poor sperm quality.
Yeah.
So
it is very important for us to know that in majority of the patients, the cause for the low sperm count or the low sperm quality cannot be made. We cannot assess why the cause or evaluate why the cause is there. So majority of the patients, it is called as idiopathic, or the exact cause is not known. However, depending on each patient, there are treatments available in the smaller percentage of patients where we can achieve very good results provided we make an accurate diagnosis. So can you tell us more about the treatment as such of male infertile patient?
As mentioned earlier, first and foremost thing is the counseling regarding the lifestyle changes. So avoid high heat exposure to the scrotum, and avoid using more of laptop computers and Wi-Fi. If they are smokers, we ask them to quit smoking, and obesity, if they are obese, we advise them on dieting to lose weight. And coming to specific treatment, here we know the exact cause for
These are the smaller patients where we can make an accurate diagnosis of the problem, and then we say you take this treatment. There's a very good chance of successful outcome.
Yes, sir. Here we know the exact cause, and so the treatment definitely will help in achieving pregnancy. Suppose in hypogonadotropic hypogonadism, this is a condition where the hormones which are produced from the brain, which stimulates the testis, is reduced. So here, if we give replacement, definitely we have to give minimum for 3 months. So after 3 to 6 months, there will be definitely an improvement in sperm count.
This is a condition where we see that the pituitary gland in the brain is not producing enough of the hormones, which in turn cause the testes to produce sperms. Now, if we treat the patient with injections, and how do we make a diagnosis? We look at their blood level of hormones, and once we make a diagnosis, we give them those injections for a sustained period of time. And then once their hormone levels these are hormones which are already present in the body. So we're just replacing or augmenting whatever is already present in the body. And then treatment with this sometimes will lead to sperm production.
And if there is some infection, like infection in the testis or epidermis, treating with antibiotics for 2 to 3 weeks might improve the quality of the sperms.
Yeah. Another important thing is that if somebody has had a bad viral infection for a prolonged period of time or a prolonged hospitalization, even naturally the sperm count can go down. This doesn't mean that it will be down forever. So we also take in the history any episode of hospitalization, prolonged illness, severe viral illness. So we look at these kind of things very carefully, and sometimes spontaneously the sperm count may recover in such patients.
Some patients will be having retrograde ejaculation. So in these type of patients, we try some medication to improve this. Suppose if it doesn't improve, then we have to refer to
retrograde ejaculation means normally the ejaculation should come out, but what happens is it goes backwards into the urinary bladder.
Yes, sir.
So it goes back into the urinary bladder. The patient will have a sensation of ejaculation, but no semen comes out, and the entire semen goes back into the urinary bladder. That is called retrograde ejaculation, and there are many causes for that.
Yes. And
depending on the cause, we would treat them appropriately.
Yes. And if there are some anti-sperm antibodies, that is the antibodies which block sperm and egg interaction, so these patients are referred for higher level of treatment like IVF or ICSI.
Okay.
So coming to non-specific treatment.
Now, once in most of the patients, we make a diagnosis and we have discussed various treatment options that are available to a specific treatment. And then there are this large number of patients who have no obvious cause for a low sperm count. We don't know what the cause is. Like I said, idiopathic, the word is called. So in these kind of patients, what we do is, depending on the patient's age and the wife's age and a whole lot of factors, we do what is called as empirical treatment. That means there is no proven evidence, but there are certain medical studies that have shown advantages. So in an appropriate patient, if we feel that we have got some time on hand, we normally try these kind of treatments, which are called empirical. That means there is no absolute proof, but certain studies have shown advantage in giving these treatments. And the empirical treatments are various type of treatments, different kinds of medicines that we give. And can you just tell us a little bit about this empirical treatment or non-specific treatment for improvement in semen quality?
So empirical treatment involves either giving vitamins, nutrients, antioxidants, or sometimes we might have to give hormonal treatment. These are some of the hormones which are given: GnR, HCG, HMG, FSH, and aromatase inhibitors. There is no proven studies, but definitely there will be some improvement in semen quality or sperm quality.
Now, it is important for us to know when to use these treatments. Now, for example, if I have a couple who's just married for 6 months, and then if I see that the husband is all right, the wife is reasonably all right, and we feel that they need more time, and they're very anxious and they come, in a lot of pressure from home. And that time what we do is that we feel that they have a possibility of natural conception, then we tell them you take this treatment and it may help, because like I said, it is empirical, it is non-specific, and it is not based on good evidence. There are studies which have shown benefit. So we tell them you take this treatment, and most of the time they conceive spontaneously, because to start with they were all right. Now, but if you have a couple who is like, if the wife is 38, 39 years old, and there we don't want to waste much time giving all these treatments, because at the end of the day, after 3 or 6 months, we find that this treatment has not helped. We would have just wasted time. There, the situation is completely different. There, we are worried about the wife's age, in which case we need to speed up the treatment and immediately tell them what is the best treatment for their age and their circumstances. Now, there are some various vitamins available in the market. So many companies coming up with so many drugs, each claiming to be better than the other, each claiming to be more efficient than the other, showing some clinical studies. We are bombarded by the pharmaceutical companies saying that, this is good, that is good, this is a new study, that is a new. Now, in this huge noise, and how do we kind of approach the problem, and what are the usual medicines that are used in this treating this male infertility?
See, these vitamins and nutrients, they don't have much side effects. So there is no harm in giving. So that's why it's better to try medical treatment. If the wife's age or wife's factors are favorable, it's better to try for minimum 3 months to 6 months, and then if it succeeds, it's fine.
Yeah.
Otherwise, they can go
Other
for higher
important
level.
thing is, I have seen patients being treated for 2 weeks or 3 weeks and all that. Now, one must realize that for a cell to become a sperm takes a minimum of 65 days. So any treatment that you give should last for at least 3 months. It is only then you would have supported that cell to becoming a sperm throughout its development. So you give for 2 weeks or 3 weeks, then that's not going to be helpful. I'm talking specifically here about these vitamins and coenzymes, etc. I'm not talking about other drugs like hormones and antibiotics, which is a different specific treatment. I'm talking about these treatment where we use vitamins and antioxidants and whole lot of medicines. We give them for at least 12 weeks.
So sperm production is a very complex process that needs several micronutrients and metals, including antioxidants and zinc. That's why we have to supplement the entire cycle of sperm production. And antioxidants are capable of reducing the production of free radicals, slowing or preventing the oxidation and repairing the cell damage.
Now, oxygen is a very useful thing for life.
Yes.
But you have what is called as free
Oxygen free
radicals.
radicals.
Oxygen free radicals. Now, these are capable of producing damage both in the sperm cell or any cell in the body, and particularly the DNA. Now, the DNA is very, very important in the sperm, because that is what is going to go to the child. So these free oxygen radicals have to be reduced as much as possible so that the sperm DNA damage is minimized. So now we give various drugs to do that, and they are called antioxidants.
Some of the used medications are like folic acid, vitamin C, vitamin D, vitamin E, zinc, coenzyme Q10, L-carnitine, N-acetylcysteine, and lycopene. Some of the newer drugs are astaxanthin. So these are the antioxidants which we use, and these come in various combinations by different companies.
Yeah, each company has their own combination. Some may have a little bit more of vitamin E, some may have less of it. So there are various combinations, and it is the clinician's preference in terms of what results he has got, what best results he has got with a particular company's combination.
Yes.
So by and large, you see that these will be the common ingredients, and I think it is important for patients to have a look at these ingredients when a doctor prescribes, and see if you go to another doctor, he will be prescribing the same thing from a different company. So it's very important for the patients to have a look at the contents of these, and make sure that they are not getting repeated in another center. So that is important. And like I said, I would again stress, I think 12 weeks or 3 months of minimum treatment is required, and there is no point in doing a semen analysis during those 3 months in between, because it's not going to make any change. Now, suppose you want to try for pregnancy during that period, by all means, you must continue to try.
And few of the vitamins, they are shown good improvement in sperm count, motility, and morphology. And while like vitamin E and L-carnitine, they are shown increased pregnancy rate.
I think this is usually understated, under-practiced. I think we all know that urban living is very stressful, and there is a decline in the male fertility over the decades. And one of the reasons is the urban living. The stress levels are high, and therefore it affects some of our hormones. And I think it's very, very important for every clinician to emphasize this, so that the patients can have reduced stress levels. And there is conclusive evidence that increased stress levels can both affect sperm quality as well as sexual performance.
So, how do you manage emotional stress? So, practice stress reduction techniques like yoga, meditation, consider about counseling, meeting a psychologist, express yourself, and stay in touch with loved ones.
Now, I think we have come to the almost the end of the discussion, Vasant, and
Yes,
then we'll just briefly talk about the commonest questions that patients ask us when we sit in the clinic.
Yes.
And the commonest question is, why is my sperm count low? No one in my family has got this problem. I think
Yes.
fair enough. Uh, each person's semen quality is very unique. It depends on multiple factors, like we have discussed. One of the important factors is the genetic factor. There is a Y chromosome in the male which controls the sperm production, the quality of the sperm, the duration of sperm production is all controlled by the Y chromosome. And there are environmental factors which we have discussed, use of substances, and a whole lot of factors. And the urban living, the stress levels, sitting in the same place, increased temperature in the testes. So these are various factors which can affect sperm quality. So somebody may have normal relationship with a wife, physical relationship, but the count is something completely independent of that, the quantity of semen or the physical relationship. So somebody could be having normal physical, but could have a low sperm count. So, and obviously it is not a hereditary, because that person has been born, and so just because somebody else in the family doesn't have a problem, a male can have a problem individually by birth. The next question is common question again: can I increase the semen quantity? We have discussed this in detail.
Yes.
There are specific treatments and there are non-specific treatments. Specific treatments, the results are pretty good. In non-specific treatment, it depends on various factors. We go through the details and then we treat. Yes, if you say, can I improve? Yes, it is possible. But if you say how successful it is, I can't put a percentage on that. But we have seen successes with empirical treatment. It is worth a try. Again, through a medically supervised treatment program and not over-the-counter medicine. I think it's
Yes,
important
it's
to do an
important.
evaluation and then see. Definitely, it can be improved, but not obviously in all the patients.
Especially when wife's factors are favorable, we
Yeah,
should try.
yeah, we should try.
What is the diet I have to follow?
Yeah,
to
this is
improve
a very
sperm
common
count?
question. I think patients always talk about taking certain kinds of foods will improve sperm count. They read in the newspaper, they read in dietary magazines. There are benefits. And can you just tell us a little bit about the diet that they need to follow to improve the sperm count?
Yes. In general, not only for this infertility, we should always decrease high calorie foods, increase antioxidants intake, increase intake of omega 3 fatty acids, increase fruit and vegetables, and decrease the processed food, avoid ready to eat packets. What are the like food which contains more omega 3 fatty acids? Seafood like fish, shellfish, and seafood. This has more of omega 3 fatty acids. Green leafy vegetables have rich in folate, which helps in DNA synthesis and protein synthesis. So that is very, very important. Fruits and vegetables are high in antioxidants like vitamin C, vitamin A, beta carotene, and polyphenols. So food that should be avoided, the highly processed food should be avoided because they are rich in meat is rich in protein, but also highly processed food will have xenobiotics, mainly xenoestrogens. The soya food, which is rich in phytoestrogen, will have negative impact on sperm quality. Potatoes, high calorie food, and sweet sugar, these are all high glycemic index food which increases hyper insulin secretion. Most of them will have hyperinsulinemia that will lead to chronic inflammation, and this is not only for male infertility. This, as a general, we should avoid high calorie foods and high carbohydrate food.
Yeah. Another common question is, can I take dry fruits? By all means, dry fruits
Definitely.
is good. This contains a lot of protein, probably contains a lot of antioxidants. I think there is absolutely no harm in taking dry fruits. There's no harm at all, and there might be a benefit.
So will certain type of supplements reduce
Yeah, there is a
sperm quality?
concern nowadays. A lot of people go to the gym. They take a lot of, the
Still.
instructors give them a lot of powders and mixtures and stuff like that. And there are athletes who take performance enhancing
Enhancing drugs.
medications. Now, there is a concern that can reduce sperm quality. Now, is that true that can reduce the sperm quality?
See, supplements, there are so many types. One is protein. If it is protein, it's nothing will happen, and it should be according to their body weight. Suppose if it is an anabolic steroid to get faster results for muscle growth, then that is not good. So that will
So it's
damage the
important
testes.
for you to know what exactly you're taking. It's very, very important to know. If it is just protein, absolutely no harm. But if there is an element of steroid, then one has to be very careful, because these steroids can affect your sperm function. Not only sperm function, it can affect many body functions, but particularly sperm function also. So you need to know exactly what that contains and not take these supplements blindly.
And this protein, which is available naturally, we can take natural foods to
Yeah.
increase protein intake. We need not depend on these supplements. Do hormonal injections help in improving sperm?
Yeah, we have discussed
We
this
have
before.
discussed
In hypogonadism, where there is a low hormone, we can give hormonal injections. But if anybody has got some sperm count, even if it is 1 million, 2 million, or 5 million, giving hormonal injections is a complete waste. Only when the hormones are checked and they are very low, then there is a point in giving hormonal injections. If the hormonal injections in the blood are normal, don't waste your time and money taking hormonal injections. Zero sperm count. Yeah, we have discussed about azoospermia. I think we will discuss that when we come to the surgical management, because I think that is more important. Surgical management becomes very important when the sperm count is zero. So I think we will come to that in our next talk. I think we have pretty much covered most of the things on medical management. If you have any questions, please feel free to send us the questions, and we'll be very happy to answer them. And thank you so much for listening in. I hope this patient education series from Gunasheela is useful to a lot of people, and we are always here to help you, and reach out to us. And we are available on askgunasheela.com. You can mail us, you can call us, and you can visit our website. So if there are any issues, please feel free. We are here to provide a service for patients who want to have a pregnancy. Thank you very much for your patient listening.
Thank you.